Good afternoon. My name is Renee Visor, and I wanted to ask you a very important question. Do you have a family member that's a female over the age of 18? The reason why I'm asking this question is because I don't believe that breast cancer awareness is being given the exposure that it actually needs to be given. It's vital that women over the age of 18 begin to have mammograms. Well, actually, over the age of 40, however, a woman under 40 could develop breast cancer. It is estimated that 1 in 8 women in the U.S. will develop invasive breast cancer over the course of a lifetime. These statistics are coming from the U.S. breast cancer statistics in October of 2012. And based on their finding, it's estimated that 230,480 new cases of invasive breast cancer will be expected to be diagnosed in the U.S., along with another 57,650 new cases of non invasive breast cancer. The reason why I wanted to bring this subject up is because, as I mentioned earlier, a lot of women aren't taking preventive care. They're not going to get breast cancers because they don't have the insurance to pay for the mammogram. I believe that the mammogram is very expensive. It just depends on where it's being done. However, what I would like to do is to advocate today for the cause of maybe getting the public, our local public health departments to partner with the Susan G. Komen Foundation as well as breast cancer organizations to come up with a program that would allow women to go and have their mammograms done at no cost. Now, personally speaking, I feel that if money is an issue when it comes down to having mammograms, I mean, it could be a lot more expensive if a woman comes up with cancer and has to have medical treatment. So, this is something that's very dear to my heart. I am one of the subjects, unfortunately, that is at breast risk cancer, however, afraid to incur any charges for a mammogram. And it's unfortunate that we choose finances over our life. Now, I do self exams each month. However, those aren't as accurate as going and having a mammogram. Now, a lot of women don't like to discuss mammograms or breast cancer out of fear that they may have it. However, it was estimated that in 1999 to 2005, breast cancer incidence rates in the U.S. decreased about 2% per year. The decrease was seen only in women aged 50 and older. One theory is that this decrease was partially due to the reduced use of hormone replacement therapy, which is known as HRT, by the women after results of a large study called the Women's Health Initiative, which was published in 2002. These results suggest the connection between HRT and increased breast cancer risk. It's just that we need to get out and advocate and become aware of breast cancer, its symptoms. For women in the U.S., breast cancer death rates are higher than those in other countries besides lung cancer. Besides skin cancer, breast cancer is the most commonly diagnosed cancer among American women. Just under 30% of cancers in women are breast cancers. In 2011, there were more than 2.6 million breast cancer survivors in the U.S. So it is noted that a woman can survive breast cancer, however, she has to get diagnosed. And my position today is that I want women to join my advocacy to make the legislator legislators or lawmakers aware that it is vital that we as at-risk women have these mammograms done. How do we do this? What we're going to do is we're going to start a bill that we'll have to take to the government and hopefully get signed. It's going to take at least 1 million signatures, which I'm prepared to put online and just see how much support I can get. Again, this is a very serious topic, and it's unfortunate that a lot of women aren't going and getting mammograms or breast exams because they don't have the finances. As I mentioned previously, I'm one of those women that are at risk but afraid to incur any costs. I want to thank you for your time, and I ask that you support me in advocating for breast cancer expenses or insurance or just some assistance. Thank you.